Good morning and welcome everyone to Awards Day 2021. This is our first ever virtual edition of the Awards Day. We are going to get started. I'm Jennifer Cook. I am the Program Director for Internal Medicine. I'll be your MC today. And before we get into the program, I want to give a shout out today, a special mention, and that is to Tim Bickle. So Tim Bickle is retiring at the end of June, a little birdie told me, and he has provided support for our Grand Round series for years. Tim, you can tell us how many years if you want. I don't know exactly how many years. And he's been instrumental in helping us switch over to this virtual platform and other virtual platforms during the pandemic. So Tim, we want you to know we hope you enjoy your well-deserved retirement.
Well, thank you very much. I've been telehealth director for 22 years, and it's been a pleasure working with all of you these past 22 years. So,
thank you, Tim. Well, today's Awards Day again takes on special significance because we'll be recognizing graduates who have not only completed their graduate medical training successfully, but also have done so in the midst of a pandemic. Internal medicine resident graduates, for example, will have spent 16 of 36 months, which is 44% of their residency training during a pandemic. Some of our fellows have spent the majority of their training during a pandemic. And so I want to start by recognizing all of our residents and fellows who have collectively demonstrated the very definitions of flexibility and resilience. And I'll now ask Dr. Barb Casper, Program Director Emeritus, to unmute her mic and begin our ceremony with a remembrance of a beloved faculty member.
Good morning. I'm very appreciative to be given the opportunity to say a few words about Stuart Urbach and also to say hello to the residents. Stuart was a beloved faculty member that we lost this past year. I think it's very fitting that we say a few words about him. He was born in Paris, Kentucky, and moved to Lexington at a young age, and so he is clearly a Kentucky person at heart. He wears both blue and red. He went to UK and obtained his medical degree, but then also did his residency training at UofL at the Old General Hospital here. So that's a place that we don't really know at this point. Following his training, Stuart answered the call of his country and went to Korea, where he was in the Air Force. And I know that he saw a lot of things there, but one of the things I remember specifically was that he told me he had actually seen a case of smallpox, which I think he's the only person I know of that actually saw a case of that, and hopefully none of us will see that ever again. But that's the history that we've lost with him. Following the war, he actually started practicing in Eastern Kentucky before he made his way to Louisville, and he was in private practice here for 35 years. In practice, Stuart was considered an internist. He took care of many patients, including other physicians. He was also dedicated, even as a private practitioner, to educating the next generation of physicians, and regularly had students and residents in his practice and relished that opportunity to teach. And so no wonder that when he retired, he actually joined the UofL faculty for full time. I first met Stuart 23 years ago when I joined the faculty here, and his passion for medicine and teaching were absolutely infectious. I had no idea how old he was then because his energy and everything belied his actual age. I remember working with him in clinic and hearing him delight. And when one of his students finally got it, they learned something new, and he once told me there was nothing better, and I actually have to agree with him on that. In addition to being a teacher, he became a friend to his students and residents. He was also fiercely competitive, and I remember one time when one of our former residents who had played tennis in college beat Stuart in a match. And mind you, this resident was at least 40 years younger than him. Stuart was not happy, and he had come up with a strategy to beat him in their next match. And I'm not sure if that ever actually happened, but I can tell you I would never bet against him. He was also an adventurer, loved to travel and hike. He rode his bike to work well and we stopped when he actually was hit by a car. I tell you an anecdote about that. He came into work that morning after having suffered that accident. His helmet had cracked, and I insisted that he go to the ER. And luckily, he was seen there. He did have some significant injuries, was in the ICU, and was back to work the next week. That's the way Stuart was. He also, at the age of 94, made his way to Alaska to watch the Iditarod. This was in March in Alaska, which is pretty darn cold there. And this just speaks to Stuart's energy and his willingness to try new things. After he retired from his full-time position as a faculty member, he continued to teach in the medical school and attended on wards at the VA. He had a passion
for the next end of next week ये लोग इसी तरह busy रहेंगे because they're going through applications और फिर वो paid positions भी खुल रही हैं.
And was instrumental in making this part of the curriculum for the students. He also became a huge proponent for medication-assisted treatment for addiction, and up until his health started to deteriorate, was working in an outpatient Suboxone clinic. So his daughter told me that he was gainfully employed up until the moment of his death. I first knew of Stuart's health issues when his daughter actually called me one morning to ask me to help make sure that his medical student class, I think it was an ICC class, that he was supposed to teach that afternoon would have a replacement. And he wanted to make sure that someone really good would replace him. He was very concerned about his students. And Stuart died that afternoon. So not surprising that his students were on his mind even as he was actively dying. In addition to his students, Stuart was passionate about his family. He adored his wife, Sherry, who predeceased him several years ago. He leaves his children and grandchildren a legacy of love and adventurous spirit that will be long-lasting. So we as a department say goodbye to Stuart. And as we say goodbye, I'm actually conflicted in my personal feelings. I'm truly sad to have lost such a great humanist and physician. He was a treasure. I also can't help but celebrate his life because, my goodness, we all should be so lucky. I used to tell people that I wanted to be Stuart when I grow up, but I don't think I could ever live up to the standard he set. And if the measure of a successful life is leaving the world a better place, Stuart was successful 100-fold. On behalf of your patients, students, residents, and colleagues, we thank you, Stuart, for the gift of a life well lived. It is something we can all celebrate. And I know we will all miss him, but my goodness, what a treasure he has been, and I'm very grateful to have known him personally. So thanks. Thank you for the opportunity to speak. And I made it through without crying.
I wasn't going to say anything, but I had noticed that. Thank you so much, Dr. Casper. And I agree. We'd all love to be like Stuart, and I agree that there will never be another person like him. Yeah. I don't think I'll ever know anyone quite like Stuart Urbach. So thanks so much for that remembrance. That was wonderful.
You're welcome. Thank you for asking me. Thank you.
All right. We're going to proceed with the award ceremony. If you all will hang on just a second, because I'm trying hard to be able to see you all and the chat and my slides at the same time, because I'm hoping that that you will offer congratulations to each other in the chat. Okay, here we go. Okay, so time for the awards. So we're going to begin our awards ceremony now with the Forrest Arnold Award for Grand Rounds Attendance. And some of you may remember that this wasn't always called the Forrest Arnold Award. This used to be an award that was actually won by Forrest Arnold every single year for more years than I can count. And so we finally got tired of him winning, and so we told him we were going to name the award after him instead. So somebody else could win it, but his name will go down in history now for the Grand Rounds attendance. Okay, so this is given to the faculty member and the resident with the highest Grand Rounds attendance record. And even though we're virtual this year, we still want to recognize these folks. So our faculty winner is Dr. Tyler Sharp. And our resident winner is actually a tie. We have two resident winners. Thomas Bierman, and Apar Dadlani. So congratulations and thank you. And we'll now present the awards given by the Internal Medicine Residency Training Program. So first, the In-Training Exam Awards recognize residents who achieve the highest score in their class on the Internal Medicine In-Training Exam. And we also recognize the residents who show the most substantial improvement on the exams each year. So the PGY1 with the highest ITE score is Quan Do. Congratulations. The PGY2 with the highest ITE score is Dylan Gerlach. The PGY2 with the most improved ITE score is Nishant Patel. The PGY3 with the highest score is Audit Chandramouli. And the PGY3 with the most improved ITE score is Mo El Masri. Congratulations to all of you. Thanks for all the silent clapping out there. Seeing some of that, I appreciate that. Our next awards are the Excellence in Teaching Awards. These awards go to the division, faculty member, and fellow who are chosen by the internal medicine house staff for demonstrating excellence in teaching. So first, I'm excited to announce the residents have honored the Division of General Internal Medicine, Palliative Medicine, and Medical Education for excellence in teaching. Next, we have our faculty member chosen by the residents for excellence in teaching. This faculty member is someone who has a wealth of knowledge and finds a way to consistently and frequently share it with residents in just the right size doses. He maintains high expectations for residents while being kind and inspiring residents to be confident in themselves. Congratulations go to Dr. Tyler Sharp. And the fellow chosen for the award for excellence in teaching is known for being exceptionally supportive of residents and always available to them to help them take the absolute best care of their patients. Congratulations go to Dr. Christopher Chan. We'll now recognize a few of our residents for their outstanding work. The award for the most professional resident is chosen by the house staff for the resident who most consistently demonstrates professionalism. This year we have a tie. Both of these residents are known for their calm demeanors in the face of the most complicated of medical situations, their willingness to always help their colleagues, and their humble natures. I'm pleased to give this award to both Dr. Viral Desai and Dipin Karmali. Congratulations to both of you. The interns are asked to select the PGY2 resident who best exemplifies excellence in teaching. I should have known that this person would eventually win this award when he specifically requested a new whiteboard for the 70s workroom that he could use for his teaching sessions, which of course I was happy to oblige. Congratulations go to Dr. Michael Eisworth. The award for the Outstanding Senior Resident, which is also chosen by the house staff, is given to the resident who best exemplifies leadership, teaching, and excellent clinical skills. This year's winner epitomizes intellectual curiosity, dedication to patient care, and a commitment to education and scholarship. She is as kind as she is brilliant. I'm absolutely delighted to present this award to Dr. Khushbu Gala. Now I would like to thank our UofL Chief Medical Residents. I expect a lot out of our Chief Residents every year, but I have to tell you that this trio has done an absolutely outstanding job during a very tough year for the residency program. Best wishes along with my extreme gratitude go to Sarah Ellingwood, who will enter Allergy Fellowship at the University of Michigan, Sam Reynolds, who will enter Medical Oncology and Hematology Fellowship at the University of Michigan, and Tyler Smith, who will enter Pulmonary Critical Care Fellowship at the Mayo Clinic. Thank you and congratulations to all three of you. Before I begin to introduce our program's graduates, I want to take the opportunity to express my gratitude to the Associate Program Directors for the Residency Program, Drs. Clay Smith, Jenny Olgis, Tyler Sharp, and Caitlin Gordon. Anything and everything that goes right in our residency program is because of their hard work, dedication, and teamwork. They're brilliant, kind, fun, talented, and they make me look good. My enormous gratitude to all four of you for making this year a success. It's now time to recognize our residents who will be leaving us this year. First, I would like to thank our preliminary interns who work tirelessly to give our patients excellent care and learn as much as they can before moving on to their categorical programs. To Simra, Chris, Brennan, Abby, Dan, Josh, Tim, Ashley, Chelsea, Senna, Scott, Jasmine, Amy, Shannon, and E, we wish you the very best as you continue on in your respective residency programs. It's now time to recognize our graduating internal medicine residents. 3 years of work in residency deserves individual mentions, so I'd like to share each of their names and future plans. Thomas Bierman, GI Fellowship, University of Missouri, Kansas City. James Bradley, Home Critical Care Fellowship, UofL. Gus Ballure, Cardiology Fellowship, UofL. Wendy Kai, GI Fellowship, Methodist Hospital, Dallas. Audit Chandramouli, Hospitalist, Community Health Network, Indianapolis. Rishi Chirate, EP Research Fellowship, Kansas City Heart Rhythm Institute. Sarmad Chaudhry, Hospitalist, VA Mountain Home, Tennessee. Scott Diamond, GI Fellowship, Valley Hospital Medical Center, Las Vegas. Moel Masri, Chief Medical Resident, UofL. Pushbu Gullah, GI Fellowship, Mayo Clinic. Catherine George, Hospitalist, Baptist Hospital East. Margot Hetzman, Hospitalist, Baptist Hospital East. Parth Jadab, Hospitalist, Norton Brownsboro. Mike Jang, Rheumatology Fellowship, Medical College of Wisconsin. Bokadir Mamadov, Hospitalist, Baptist Hospital East. Kyle Mills, Primary Care, Baptist Health. Cody Moore, Chief Medical Resident, UofL. Chris Moser, Nocturnus, Norton Healthcare. Gaya Suresh Kumar, Hospitalist, UCSF. Ashley Twyman, Hospitalist, UofL Health, Marian Elizabeth. Pradeep Vamula, Hospitalist, Non-Teaching Team, UofL. And James Vernacci, Chief Medical Resident, UofL. So huge congratulations to the class of 2021. Next, we're going to recognize our MedPeds residents. And is Dr. Workman on, or Dr. Bishop?
I'm here, but my video isn't working, so why don't you go right ahead?
Okay. All right, so Dr. Workman sent her apologies. She's actually on PED service right now. And oddly, the pediatrics department does not plan their call schedules around our medicine awards day. So she was very sorry to have to miss today. So we have 3 graduates from our MedPeds program. Christy Giles, who's going on to a pediatric sleep medicine fellowship at University of Colorado. Caleb Huber, who will be an outpatient medicine and an assistant professor in Indianapolis at IU, and Bree Trishon, who will be joining our Palliative Medicine Fellowship here at UofL. So big congratulations to all 3 of our MedPeds graduates. All right, next, Dr. Smith will represent the Division of General Internal Medicine.
Good morning, everybody. I'm Clay Smith, the Division Chief for General Internal Medicine and Medical Education, and I have the honor this morning presenting awards to the best general internal medicine teaching faculty in ambulatory settings as voted upon by our residents. The recipient of our first award, Best Teacher in the Hospital, has been described by a resident as a wonderful attending who balances teaching and taking care of patients in an efficient and seamless way. Another resident said that they had a good sense of humor, was always considerate of the residents' workload, and was easy to communicate with. Our award winner has very early in their career developed an outstanding reputation as a clinician and as an educator, and will be advancing in rank from assistant to associate professor this July. Please join me in congratulating this year's winner for Best Teaching Faculty in Hospital Medicine, Tyler Sharp. Our division's second award goes to the Best Teacher in the Ambulatory Setting. This year's winner is known by residents as a passionate teacher who provides constructive criticism and feedback. Furthermore, they use an evidence-based approach and are a fierce advocate for our patients. As division chief, I have appreciated this faculty member's commitment to improving our clinic and keeping both faculty and residents abreast of changes in outpatient billing and coding. Please join me in congratulating this year's award winner for Best Teaching Faculty Member in Ambulatory Medicine to Dr. Erbach.
Thank you, Dr. Smith, and congratulations, Dr. Sharp and Dr. Kua. And next we will ask Dr. Pate to present the Graduating Palliative Medicine Fellow.
I'm Kim Pate, and it's my honor to present our wonderful fellow this year, Dr. Ben Hanna, and he's going on to do pediatric palliative medicine at the University of Oklahoma at their Health Science Center, where he'll continue to take this excellent care of children and their families, and we're so honored and proud to be part of his training. Thank you, Jen.
Thank you very much, Kim, and congratulations to you, Ben. I will next ask Dr. Gafgazi to present our cardiology fellows, and we'll follow that with Dr. Ikram to present our interventional cardiology fellows.
So we have 5 graduating in general cardiology fellows this year. Dr. Chris Fine will join as a faculty cardiologist to National Jewish Hospital in Denver, Colorado. He's joining Dr. Hirsch, for the ones of you that remember Dr. Hirsch here. Dr. Harleen Chehel is going to start interventional cardiology fellowship here at the University of Louisville. Dr. Natalie Kelsey will join interventional cardiology fellowship at East Carolina University. And Dr. Vipul Madwani will start as a private cardiologist at Chain Regional Medical Center in Wyoming. And finally, Dr. Mohammed Mathbout will start interventional cardiology fellowship at the Medical University of South Carolina.
Thank you, and congratulations to all of our fellows. And Dr. Ikram, are you on?
Yes, can you hear me?
Yes.
Okay. First of all, good morning, everyone, and congratulations to all the outstanding residents. So likewise, we have 2 outstanding interventional cardiology fellows. It's a mixed feeling every year. You get to know the interventional fellows more than your own family in 1 year. And Dr. Ahmed Al-Hamouri joined us. He did his internship at the University of Minnesota, and then his cardiology fellowship at the University of Southern Alabama, and came here. And he has done an outstanding job and is moving on. He's staying actually close to town. He's joining Hardin Memorial Hospital in Elizabethtown with Baptist. His wife is pursuing a PhD in pharmacology, so he's staying here. We are really happy that he'll have a continued presence as a graduate faculty. Dr. Imtiaz Ismail is also known to us because he did a research in our labs before he joined our division. And he is moving on to Missouri in a private practice group. Basically, he'll be running their lab. So both of these fellows, I mentioned that interventional cardiology is all about numbers, and as well, of course, academic excellence. So both of these fellows have done close to 1,000 procedures. You know, the requirement is 250, and they have done 500 interventions and plus another structural and peripheral. So they have outstanding training, and I go across the town I go across in the nation in meetings, and very few programs in the country have that volume, that much volume. So congratulations, Ahmed and Imtiaz, and good luck to everyone.
Thank you and congratulations. And while we're on the subject, I just found out this morning that Dr. Ikram himself has won an award, a hero award from the VA. So I wanted to say congratulations to Dr. Ikram as well. Next, yeah, you're welcome. Thank you. Next, I'll ask Dr. Krishnasamy to represent the endocrinology division.
Good morning, everybody, and congratulations to all the graduates. This is a special year, as Jen Cook already mentioned, with many of our graduates spending much of their time during the pandemic. And I have a very special graduate, our fellow, senior fellow, Malika Rawal, who's also a chief fellow. And she came to us from UPMC Mercy Medical Center in Pittsburgh, and she's done an excellent job and has been a great source of support for the incoming fellows last year, right in the thick of pandemic. It was wonderful, so good that we decided that she has to stay with us. So she'll be joining us, our division, as faculty come August. And I offer my congratulations and welcome her aboard. And thank you.
Thank you very much, and congratulations, Malika, and we're very, very pleased that you'll be staying on faculty with us. And next, I'll ask Dr. Perajuli to represent the GI division.
Thank you, Jen. Can you hear me?
Yes.
So I'm delighted to announce our graduating fellows. It's been a pleasure working with them, knowing them, being part of their training, and they've all done a fantastic job. Dr. Ikram, just like Dr. Ikram, our fellows, they get a ton of procedures, they get a ton of exposure, and, they go out to be fantastic providers and teachers. So thanks for the hard work, all the fellows, and congratulations. So our first fellow is Dr. Paula Adamson. Paula served as the chief fellow, and, that's not necessarily an easy job. So did a fantastic job. I really thank her, appreciate her. I came to rely on her immensely for the schedule and, putting out fires. Paula is going to Morrow School of Medicine. Well, she'll be joining faculty, and I'm hoping that she'll, maintain ties with us. So great work, Paula. Thank you. Our second fellow is Sarah Safadi. Sarah also did a fantastic job. She was very, cheerful, always lively, worked for fellow well-being activities, and so she was also very active in system improvements and contributed to, us improving different things. So one of the things that all the team in our program, will remember her for a long time is last year when we had virtual interviews, we decided we'd come out with our own videos to introduce the program, the hospitals, and the fellows, and she did a phenomenal job. Her videos, she went around, cornered all the attendings, the fellows, and she came up with videos that were probably better than professional quality. So thank you very much, Sarah. And Sarah's going to Colorado. She's joining the University of Colorado. So good luck. Third fellow we have is Tyler. Tyler apparently finally got some vacation time. So Tyler's the quiet and the stoic type. You would not know. He's like quiet and just gets the work done. And I didn't know this, but apparently he's very popular among the nursing staff, probably because he's quiet and just, gets the work done. So one thing about Tyler that I'll never forget is he, in the midst of the COVID, he came down with a fever and he was self-isolating in his basement at home, waiting for COVID test. And we're in clinic. I was trying to scramble, he's got this patient and, I'm trying to find fellows. And we get this message that, the patients are being seen. I'm like, from where? So apparently Tyler is in his basement doing telehealth appointments while he's supposed to be, sick and isolating from COVID. So from that time, he got the name of quote unquote animal, that he never comes down, nothing gets him down. So Tyler is going to work across the river in Southern Indiana group, and just a testament to our legacy. We have, 5 folks in the Southern Indiana group, and all our graduates. If you look across town, Baptist, Southern Indiana. We've had colleagues going, our graduates going, locally and all over the country. So we're really proud of that. Rachel Kennedy is our next fellow. Rachel was kind of quiet, but she's a very caring fellow. I never could get her off the internal medicine, mind frame. And GI, we're busy, we're just running, but Rachel took great care of her patients down to the very last detail, and she would not let go of anything. So she was also contributing to our system improvement activities. Rachel's going to join kind of a, academic kind of private practice. She's going to Jewish East, so we'll be, seeing her often and running into her. And last but not least, we have Prasanna Ponagodi. Prasanna came to us from IU, where she was doing some research work, working with the world-renowned gastroenterologist, Dr. Doug Rex. She's continued this trajectory, and she's, very active in her scholarly work, has many publications. She did very good in board review. And more recently, she's been engaged in big scholarly activities / quality improvement. So we're looking at this big colonoscopy database, and that should make a lot of quality improvement impact, and also collect a database or a registry that's going to help us improve patient care. Prasanna is going into private practice in Indiana, close to Indianapolis, and I'm hoping she'll maintain ties with us and continue the scholarly work. So great job, all of you. Thank you very much, and you'll do fantastic in your career. And now I'm going to ask Dr. Adamson, our chief fellow, to announce we have this tradition of, the fellows choose a teacher of the year. So go ahead, Paula.
Thank you. Good morning. It's my pleasure to announce the teacher of the year for our department, who was selected by all the fellows. So I'd like to present the award to Dr. Barbe. Hopefully he is on. Some of the things that the fellows have mentioned over the past year, at least, of their experiences, that he provides excellent clinically relevant teaching. He's a great teacher as far as endoscopic skills, and most importantly, he takes the time on rounds to go through all the details for all the patients to thoroughly get an understanding of the pathology, as well as how every component and feature contributes to the disease pathology for the patient. And for that, we thank you for being an excellent teacher, Dr. Barbe.
Thank you, Paula. Congratulations, Dr. Barbe, and congratulations to all of our fellows as well. And I'm glad to see that we're, like Dr. Perjoli said, that we're still helping to populate our local practices, as well as send some people off to other areas of the country to represent our program. And next, I'm going to ask Dr. Arnold of the Grand Rounds Attendance Award fame to represent the Infectious Diseases Division. I'm going to love this if he is not attending today. All right, well, since I don't hear him coming on his behalf, I'll congratulate Darman Aiden, who will be graduating and going into private practice in West Palm Beach, Florida. Congratulations to you. Next, we'll have Dr. Rojan for the Medical Oncology and Hematology Division.
Hello, good morning. We have 3 terrific graduating fellows this year who we wanted to congratulate and recognize. Dr. Brian Dong trained here as a resident and as a fellow, and will be staying on as faculty here at the Brown Cancer Center. Dr. Rohit Kumar came to us from Chicago at Cook County, and also we're lucky enough to be keeping on here as faculty next year. And then Dr. Drew Murray, also a graduate of this residency, is originally from Canada and wants to move closer to home. So he's going to Northern Washington to work in Bellingham, Washington. We do give out a Fellow of the Year award every year, and that went to Rohit this year. Congratulations to everybody. Thank you.
Thank you and congratulations. And so glad to hear that a couple of our fellows will be joining our faculty this year as well. Next, I'll turn the mic over to Dr. Rivas Perez, if you're here, for pulmonary and critical care.
Yes, hi, good morning. Congratulations to everyone. I have the honor to congratulate my 3 graduating fellows. This is a very special class. The first one is Christopher Chan. He will be joining a practice in Wellstar Health System in Atlanta, Georgia. He also I'm very happy that he just won the Fellow of the Year award by the residency. He works very hard every single day. The second is Arjun Godasara. He will be joining St. Francis Medical Center in Monroe, Louisiana. And then lastly, my chief fellow, Hassan Seb. He will be going to Little Rock, Arkansas, to a Baptist Health Medical Center. So congratulations to the 3 graduating pulmonary critical care fellows. And now I'll leave the mic to Dr. Guardiola to present the sleep fellow.
Thank you, Dr. Guardiola. I'm not sure if it was just me or everybody, but the mic was breaking up a little bit. So I'll just in case others couldn't hear, this is Quang Wen, who is a graduate of our residency program here. And it looks like we've managed to keep him in Kentucky for his practice. So I'm really glad to see that, and congratulations to you, Quang. And that concludes our program today. So I want to thank everybody for attending and say congratulations one more time to everybody, and remind you that this is our last grand rounds of the academic year. And so we will see you back in some form or another in September. Hope everybody has an enjoyable and safe and educational summer, and we'll see you soon. Take care and thank you.
Well, thank you so much, Dr. Cook, for pulling all of this together and putting together an outstanding virtual program. And congratulations to everybody, all of our award winners, and everyone who's graduating and moving on to upward and onward. And again, thank you, everybody. And from my end, thank you, everybody, for hanging in through a unique grand round season. And it's actually it's gone swimmingly, a lot better than I was. It's gone a lot better than I was hoping for, and I really think this might be kind of the wave of the future with virtual grand rounds going forward. We'll have to kind of see, but thank you again, everybody, for, like I said, for being good sports through the year. And we've had seems like, and I told Dr. Kruger in a conversation earlier, I think we had great lectures all through the year, and I appreciate all of the planners and all of the coordinators for helping with that. All of the people on the call right now who may have given a presentation this year at Grand Rounds. I just want to thank everybody for everything, and hope you have a great summer. And we will see you on September 7th That will be our next grand rounds. Dr. Kruger, as tradition, the department chair gives the first grand rounds of the year. So mark your calendars, 8 a.m. September 7th.
Great. Thanks, Jason. Thanks for all your hard work on grand rounds this year.
Appreciate
Everybody
it.
have a
Thank you.
great day. Bye-bye.
Thank you.
Thanks, everybody.